The American Hospital Association has described the hack as, quote, the most serious cyber attack in history on the healthcare system. It began about 2 weeks ago when hackers shut down a payment processing system run by a company called Change, owned by United Healthcare. Change essentially functions as a middleman between insurers, providers, hospitals, and pharmacies.
That's right, guys. The biggest cyber attack in healthcare history. How much did you hear about it? Probably like me, not at all. The corporate media didn't report on any of this, and it's coming out on YouTube and other segments of content in onesies and twosies. So did this impact you? It might have impacted you because according to the stats, 67,000 pharmacies are using United or Change Healthcare. So United Healthcare bought Change Healthcare for $8 billion. Okay, so what did this affect? So number one, patient billing. If you were a patient, you couldn't transact because the middleman was taken out. Number two, if you're trying to get your medication from your local pharmacy, if it was one of the 67,000 pharmacies, you couldn't get it because they couldn't transact the payment. Number three, if you're a doctor, you couldn't reimburse, meaning you couldn't get paid for the service you were providing. So some doctors, both in small and large practices, had to take out loans from United and Change Healthcare. Number four, if you were trying to transact an insurance claim, you couldn't. Now, albeit this was a short period of time, one of the reasons this was only a short duration of time is because, according to reporting, United and Change Healthcare paid $22 million in ransom. That's right. Now, when asked about that from journalists, they didn't comment. And you would think this would be an inquiry by the Department of Justice or some kind of federal government entity would be regulating this, talking about this in some way, because it's affecting and impacting so many Americans. But it's not even close. One of the most significant impacts to people that was life-threatening was people could not go to the pharmacy and get their medication unless they paid cash out of pocket. And because insurance claims couldn't be processed through the system, they had to pay, in some cases, full price for things like insulin. We've funneled all of our resources in one vulnerable system. I saw a recent report where one of the journalists was questioning an FBI agent. And the FBI agent said, well, now we need to be smarter about our information. And you should question the healthcare provider about what personal information is accessible and what vulnerabilities might exist in their system. Now, I don't agree with this expert because most people who go to get healthcare don't expect to have a conversation about encryption or cyber warfare or security hacks against their information. And who are they talking to in the first place? A patient advocate, an insurance processor? They're not going to have any information about the inner workings of the systems that are vulnerable right now. So that doesn't mean just blow it off, because if you're a patient, 2 out of 3 patients are not going to be part of this system. If you are a patient of any healthcare system, which I certainly am, and Veteran Affairs, which was affected by this hack, you will be affected no matter what eventually. So what do you do about it? What can you do about it? Well, if you belong to the healthcare system, just like if you're depending on security, like first responders, as your first line of defense against something going wrong, you're setting yourself up for failure. You're setting the wrong protocol. Get medication, for example. Now, recently, in my own curiosity, I wanted to see if I can get antibiotics in America sent to my front door. So I went online, filled out a questionnaire, and got antibiotics sent to my front door. Now, I have no affiliation with Jace Medical. I just used them as a consumer, but I was surprised at how easy it was to do a questionnaire, transact, and have it sent to my front door without once speaking to a medical professional. Recently, I was in Tampa Bay, Florida, filming a show called Surviving Man. It's MANN. I was with Don Mann and the crew. Amazing experience, amazing group of people. When I was there was a company called Contingency Medical. Now, Contingency Medical provides the same services that Jace Medical does, except I got the opportunity to talk to the owner. Again, no affiliation, no sponsorship. I just had a conversation with him. I wanted to know, how does this work? How are we able to go online, fill out a questionnaire, and get prescription medications sent to our front door? And he said it's absolutely legal in most states. When you go overseas, you don't have to lean on the third world country in sub-Saharan Africa. And I totally get that. But also, as a homesteader and somebody who's into the area of preparedness, I'm like, oh, I could stockpile this on the shelf. So interestingly enough, I definitely want to have Tad on. He's also an ER doctor, so I trust ER doctors, and he's out of Idaho. He's right down the road. So there are a couple providers in Jace, which I have firsthand experience from, and Contingency Medical, which I'll link down below, both of them. Again, no affiliation, where you could order these things online. Now, some things that are a little bit more complicated, I assume like insulin, I'm not a diabetic, but I assume like insulin, you have to do a video teleconference in order to get some of that. But why are we not doing that, guys? Why are we depending on a process that's very slow, very inefficient, and now we know very vulnerable? We should be able to get medication for specific things that we need and self-treat. Yeah, you need doctors. You need nurses. You need hospitals. You need the system. But a lot of the things that you go to the hospital for, like I recently took my daughter who was sick, who had a stomach virus. I knew exactly what they were going to say. I took her in because I wanted to make sure it was documented, and I wanted to get the extra level of examination and expertise from the expert, the doctor. And I got that. And I had a good peace of mind. But I knew they weren't going to give her any specific medication besides anti-nausea medicine because it was a virus and it had to run its course. But there are a lot of things that you're exposed to, a lot of ailments that you potentially get, and a lot of things, even in diabetes, where you need to have these things on hand to protect yourself, which I like the name contingency med because it makes sense. So don't just be a victim waiting on the reactive side of a system being attacked, because this is only the beginning. I'll talk about this and more in the underground on my patreon.com/Mike Glover. You can see it down below. It's the link down below, because a lot of this stuff that's controversial, more controversial, I can't talk about it. I'll also be doing tier 1 content on a couple of things, including protecting your information. So protecting your information, whether it's cyber attacks and the vulnerabilities that exist from the CCP to the domestic hacker, you have to be able to protect your electronic equipment. That's not just your cell phone, that's your laptop, or anything that's Bluetooth, Wi-Fi connected that has the ability to be exploited. I mean, I talked about this recently. Let me cut this off, actually. From a company called SLNT that does Faraday bag protection. Now, this is the dry bag that has the ability to put all of your equipment in, whether it's ham radio devices. This is actually the one this week on my YouTube channel. I'm coming out with a new video on a 40-liter disaster bag, what I put in my 40-liter for my family. Now, if you have a 40-liter, that is enough capacity to take care of everybody in your family and yourself. If you have a 20-liter, that's just you. So my 40-liter, which is like obviously a bigger signature, I'm stuffing all of the commo gear that I have that's potentially going to be vulnerable, including sat phone, ham radio, GMRS, all of that in here, because it will protect it from electromagnetic pulse, but it will also protect it from exploitation. And the technology is simple, but the quality in this is really, really good. In fact, I have a coupon code for you at the link below for things like this, the laptop case that I use, and the Faraday bag for the cell phone that I use. I even started using the Faraday bag protection for my cell phone at night when it's by my head, because I don't like sleeping with an electronic device giving off all of its signals right by my head. This thing, even when dead, is giving off a signal. It's why you could find your iPhone when it's turned off or completely exhausted of its battery. Also, reminds me, because this beautiful knife that I use to cut a tag off, also that I use on my hunts. If you're a big fan of Montana Knife, I want to say thank you for selling out another Fieldcraft Survival and Montana Knife collaboration on the Fieldcraft Survival knife. That knife we've worked really hard for. It's now the 7th drop, and we sold out in less than 7 minutes because of you guys. I appreciate you guys. You can use MF10 to save 10% on your first purchase. And also, if you're a member of my underground or my channel on Instagram, you guys can get early buy-in to that. We usually save a couple hundred of those knives for my subgroups. Last but not least, we just did our new drop of our new tactical range bag with Gritter. We worked really hard on this bag. Big shout out to Gritter for helping us out with this process, especially in textiles. It's difficult to do, but this is one of the best design range bags we've ever had, and it's the range bag we always wanted. That's available now in the link down below. I want to say big shout out to everybody who came out to our Cyber AI conference over the weekend. I did a podcast on the Mike Force podcast with Joe Kent. That's dropping really soon. Also, looking forward to the new podcast this week with the first man in history to jump free fall behind enemy lines in combat, who is a member of MACV-SOG. That podcast will be dropping this week on Mike Force Podcast. He talks about being the number one jumper on the first jump that SOG ever conducted out of the 6 jumps it did during Vietnam, some which ended catastrophically. But I'm really looking forward to that podcast to drop. You guys can find it on Mike Force Podcast on YouTube, as well as wherever podcasts are found. Guys, I'm headed off to the underground. Till next time, peace out.